I am Dr. Ashish Sapre, consultant pediatric cardiologist, Medicover Women and Child Hospital, Hyderabad. So I want to brief about this case we have recently operated, which is a very complex and rare case. This case is basically described in literature as a pentalogy of Cantrell. It is a combination of defects, midline defects basically, involving anterior chest wall, that is sternum, absence of sternum bone. Then there is a midline cleft in the diaphragm. So thoracic contents are protruding into the abdominal cavity through that gap, and all the abdominal organs like liver, gut, stomach, spleen, all are protruding outside through the cleft in the abdominal wall and protruding outside and are covered by thin membrane. So this is a very complex condition. Adding to this, there is an intracardiac defect also, which includes a single ventricle. Means normally we have two ventricles pumping the blood. Here there was only one ventricle with pulmonary artery which was absent, means not connected with the ventricles. So blood circulation in the lungs was dependent on alternative source, that is a patent ductus arteriosus, which was restrictive. So child was just saturating around 60% when I saw this child. So miraculously this child has survived till 16 months of age. After this, survival will be very difficult and they are likely to succumb during the toddler years only. Very few survive till this age. So luckily we came in contact with this patient and we convinced the parents, and with the government support, Tanzanian government support, they came to this place. And this kind of cases can be only dealt in kind of a setup where there is multi-speciality, super specialties, pediatric is available. So we had a team of surgeons with us, like pediatric CVTS surgeon, pediatric general surgeon, plastic surgeon. So all this we form a team, we discuss, and we formulated a plan. Now, since it is a very rare condition, there is a very little literature available across the world. And most of the cases either were treated very late in the condition or they were operated in 2 stages. Since we had lot of issues in this child, so we decided to operate in a single stage. That means the intracardiac problem as well as the abdominal problem was dealt in a single sitting. So we planned, after a lot of investigations, 3D mapping, all kind of CT, MRI, everything we did, and we formulated a plan. And we operated, which operation initially was a cardiac condition, then after that pediatric surgeon took over, and then plastic surgeon. So operation lasted almost 14 hours. We shifted the baby to ICU in a stable condition, and whatever were the challenges in the OT and ICU were dealt promptly by our cardiac anesthetist and intensivist team. Dr. Pavan heads that. And after this, once the patient was extubated within 24 hours, and after that child has shown tremendous improvement in the condition, and we could get her out of ICU within 4 days, and she is ready for discharge in 10 days from the hospital.